You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network. Yaral Pharma, an innovative player in the U.S. generics marketplace, has partnered with the Pharmacy Podcast Network to educate and build a network of pharmacists about non-scheduled, non-controlled prescription alternatives for pain management. We encourage feedback in establishing new connections with pharmacy care providers. Learn more at yaralpharma.com. That's YARAL Pharma.com.
Diclofenac epolamine topical system, 1.3%, is indicated for the topical treatment of acute pain associated with minor strains, sprains, and contusions. It is approved for use in adults and pediatric patients aged 6 years and older.
Hey, this is a special episode of a sponsored podcast that's focused on sports pharmacy, and we'd like to give a shout out to Yaral Pharma for being our sponsor today. And sports pharmacy is part of the expanding role of our pharmacists throughout different facets, the ecosystem of healthcare. And I learned about sports pharmacy from a team that is in my favorite. I know I'm from Pennsylvania, but my favorite state is quickly becoming Florida. I don't know what it is about Florida and pharmacy, but it's an innovative state for sports pharmacy. A shout out to Dr. Brandon Welsh, and Mr. Nichols, who has really focused on the expansion of sports pharmacy. Today, we have another pioneer in the space, Jessica Beal-Stahl. Dr. Stahl is with us today. Jessica, I am thrilled to have you here talking to us about sports pharmacy.
Thank you for having me. I'm so excited about this conversation. And I enjoyed this meeting, Steve, and you at APHA back in Nashville a few months ago. And so I'm excited to continue this conversation today.
My co-host, Stephen Beckman, CEO of Yaral Pharma. Stephen, it's so good to have you in the new studio.
Yeah, it's great. You had a great one before, and now you've just done it up another notch. And I would echo what Jessica said. It was a really great opportunity for us to meet her at the meeting. That's one of the things that we feel is really important as an organization is we have to listen first. A lot of times companies don't like to do that. We kind of listen a little bit or we take actions. But the most important thing we learned is we listen to the experts. We truly do find better ways to articulate, the value of what we're trying to do as an organization. And obviously, Yaral's made a commitment to pain and inflammation through our portfolio of patch products, and really, really excited to dialogue with Jessica today because obviously sports medicine is huge, and there's a lot of dynamics going around there, and understanding how we address pain management in sports medicine is obviously a fundamental component of what they do. So really looking forward to the conversation today.
I'm looking forward to it as well. And we're going to kick it to Jessica first. And that is, give us a definition of sports pharmacy, what that means to be a sports pharmacist, an athletic-driven pharmacist that's dialing into the athlete. And I'm thinking of our weekend warriors. I'm thinking of our NCAA sports. I'm thinking of our professional sports and even high school sports, with the expansion of understanding how a pharmacist can dial and make things better. Give us an overview, Jessica, of sports pharmacy and yourself.
Yeah, so they're working on a formal definition now because there's really not one out there. And so U.S. Sports Pharmacy Group is working on that and putting that out there. But basically, to sum it up, it's a specialized field. So like you think of like geriatrics, and then there's sports medicine. There really doesn't a sports pharmacy field yet in the practice of pharmacy, but it is the specialized field of pharmacy that works with athletes, as you said, of all demographics. So this is not isolated to just professional athletes or like Team USA athletes. We're looking at, like you said, weekend warriors. It might be a high school athlete, NCAA, all across the spectrum. And we're working with athletes and their healthcare providers or athlete support personnel, so coaches, strength and conditioning, athletic trainers, all the way into sports med, orthopedics, and we're helping them optimize both their medications and their supplements to both improve performance and improve their health. And I think that is a big aspect, is we're not just as sports pharmacists looking to make them play better and perform better, but we want them to live healthier and longer lives. So it's a combination of the both. It has a lot to do with education, getting awareness out there about medications, because most people don't think about medications impacting performance or outcomes. It also has to do with a lot of advocacy. So advocating for the health of that athlete. Sometimes I'm a high level athlete myself. And so sometimes I can be super stubborn about like something hurting and needing to pause or take some downtime or go to PT. So having a provider on the side that says, hey, this is what we need to do, take a short-term rest for long-term gains, can be very powerful. So having a sports pharmacist understand both the athlete side and the medicine side can be very beneficial.
That's really actually insightful, and something I didn't think about is, I think most people think of sports trainers or sports medicine really to address the immediate issue. Somebody's hurt, trying to get them back on the field. So I really appreciate that comment at that. When you think about sports medicine, sports pharmacy, you're really talking about how you have to look at the kind of the long-term perspective of the patient, and the decisions you're making are both for the near term and long term, which I think most people probably don't think of it that way. So that's great that that's the direction in which sports pharmacy is going in.
Yeah, most people think athletes, then they're super healthy. And, you have the acute like ACL tear, or you have a twisted ankle or high ankle sprain. We see those concussions where they look very, very acute. But there are many athletes out there that are dealing with chronic conditions, osteoarthritis, asthma, diabetes. I have some that even do autoimmune conditions that are still playing and at super high levels. So they're not immune to, the regular health conditions we all have too.
Well, I know, Jessica, when we were together with Todd in Nashville, which is always a great location, we talked a lot about the concept of options in pain management. So maybe that's a good kind of segue into kind of talking about how you guys look at the importance of options, and how do you guys approach those options as it relates to the different patients in which you support and serve.
Yeah, I love that. We had this conversation about options, and I think it's really powerful as a provider to be able to sit and have that time and that conversation to kind of do shared decision making with your athlete and your patient, who you can break down, here are all the options, and not just tell them this is what you have to do, so that they can understand what may be impactful to them. I think so many athletes right now choose to just go to over-the-counter ibuprofen and overdo it and don't understand the risk of it and don't ask very many questions. So as I do a lot of work with high school athletes and college, and I see this so overused, and you can even ask some trainers and nobody might even know the correct dosing for it. So I think one is education on there are other options out there, from even topical diclofenac gels to patches to other prescription medications, and that using ibuprofen consistently is not always the answer, and that there can be other things that could help to help manage conditions, either acute or chronic.
So you talked about topical. So maybe could we dive in maybe a little bit to more of the significance of topical analgesics in sports medicine? And are there things that you do, are there a particular type of scenarios where that option makes more sense? Obviously, overusing ibuprofen is not a good long-term strategy for anybody. But I'd be really curious what your thoughts are in terms of the significance of topicals, and where you see them best fit, or how do you guys look at that option within your armamentarium?
Yeah. So topicals are usually one of my first choices for most athletes, depending, especially if it's a injury to or a problem with a single joint or maybe two joints where it's very isolated. Most people think that, if you take an ibuprofen, it it's just going to work on that joint. And that's not true. There's going to be impacts throughout your body, which is why we have side effects in like the gut and impairment in like microbiome and nutrient absorption. So that list goes on. So I like topical solutions because we can isolate it to just the area of pain and inflammation, and we aren't getting the full systemic impacts to the rest of the body that we might not need. So usually topicals are one of my first choices.
Well, that's interesting. So the option to be site specific is helping you actually do analysis on kind of where the pain is, and that has a downstream effect then in terms of all the other providers that might be incorporated into that, and without having that insight that maybe you do something different that you don't want to do or something you don't have to do, I guess.
Yeah.
So when you think about those advantages, which you clearly spoke about in terms of being more site specific versus maybe an oral, is there anything else that's important in your thinking of topicals besides as an option to the scope of things that you have at your hands?
I think it's convenient. It's very convenient for my athletes to put it on in a location. We can use tape if we have to during practice. It's Florida, so sometimes it may sweat. So sometimes I do have to adjust a little bit. Like creams are a little bit more challenging to work with than patches sometimes, because creams, if you're trying to put it on before practice and then you're going out and you're sweating, you may not be getting all of it absorbed really well. So sometimes we may use some combination of different topicals because of just some of those challenges that they do present also. Yeah. That's probably the biggest thing is like, when are we applying it? How can we make sure we get the appropriate dose to that area?
Yeah, another kind of cool comment there, because obviously you have situations when you're managing pain, especially for athletes, is you're managing why they're still performing or still practicing. So if they're in Florida and it's 95 degrees and 100% humidity, different if you're maybe up in somewhere north where it's not as cold or not as humid or hot. You mentioned something that kind of triggered a thought in my head, and that is from a training perspective, when you as a pharmacist or a physician are being trained in sports medicine, is there like a kind of a process way they kind of train you in terms of attacking this, saying, hey, look, when we see about pain, the first thing we need to do is start with immediate systemic to calm and then assess, or to your point, topical. So I was really curious if there's kind of a guidance or there's a lack of that right now, because you need to be flexible in terms of how you assess, pain in that particular athlete.
There is not a guidance. It would be amazing to create something like that, an education program for pharmacists. I get a lot of questions from athletic trainers because they're so accessible to these athletes and they get very little pharmacology and understanding. And so they can tell me about ibuprofen and there's topicals, but they may not know the dosing. So I get a lot of questions out of athletic trainers on how to best support their athletes with over-the-counters, and then when do they need to move to a prescription strength or see a provider. And sometimes I even get questions from providers because they're like, yeah, I have this one. This is the one I use. This is the one I see works, but is this the best option, or what other options are out there? Because there's just, honestly, as you know, there is so many things on the market, and trying to keep up with them all can be challenging. So being able to have those conversations and provide education, like I said earlier, is definitely part of the definition and the job of a sports pharmacist. Is our role is understanding the pharmacology of the drugs, which drugs work best in what situations, which dosing mechanisms and what forms do you have as options to give them and say, hey, here's when this might work best, this given this situation of the athletes still performing, the athlete's injured, the athlete's training in Florida, they're a swimmer. All of these play roles in what might be the best choice for that patient. So I think it makes sense why a pharmacist should be on the team, but it's definitely not something that we get training on. It's been a life learning process for me, and understanding like what all options are out there. So maybe an idea.
You should do more of this, because you segued right into probably the next important question for us. And that was, why we're here. The Pharmacy Podcast Network is an amazing platform And Todd has done a heroic job to create a platform that now I think reaches over 100,000 subscribers, and really creating a way for people to get more intelligent, to get more information. I always speak to my group about knowledge capital, and part of our parallel job to our day job is to continue to find ways to increase that knowledge capital. So you had said the word role, and that's really kind of where we wanted to go to next is, the role of pharmacy. And then the second part of that question is, we as a manufacturer, how do we continue to support pharmacy in that? Because what I heard you say is that, when it comes to pain management, the people that are kind of on the front lines, being the trainers, the physicians that are doing this, still rely very heavily on the pharmacist and pharmacy to help guide them in that. And so, so is your role, how do you describe your role? Obviously, you just said it's kind of an educational role or transition, but it's got to be bigger than that too. So I guess the question is, how do the pharmacists really fully interact with either the provider or maybe the athletic trainer?
Yeah, that's a great question. And I think some of it depends on the setting of the pharmacist. So I can speak from my role in a community pharmacy and as a consultant. And then there's also roles where maybe the pharmacist is embedded in a sports medicine program in like a health system. And then I have a lot of colleagues who also work in the university setting, and they can interact through student health or through the athletic training department. But I think in all situations, we are there as a resource to be able to have those conversations either directly with the patient, and then provide either insight to the patient or reach out to the provider, or be a resource for the provider to say, hey, what do you think the best option is? What would you recommend? It may be that I'm in a small town community in Florida, and I've had a long-standing relationship at the independent that I work for. And so people know about reaching out and that we're there to support them. And so we get lots of calls from providers on different athlete cases or different patient cases on what is the best resource or the best recommendation for this patient. I'm not quite sure, based on insurance and different situations, whether that be geriatric or sports med. But I think the biggest thing for pharmacy is making that voice known, that we want to be there to answer those questions and not just put them to a voicemail, and have those conversations. And I think that starts to build the value of what pharmacists can really bring to the table, versus just dispensing a product, that we're actually can provide services to the patients and to the providers that can add benefit to long-term health.
Wow. So look, I agree. I think, the transfer of knowledge capital, as I just used that word before, is essential to what you're providing. And I think another insightful point is that we have to remember that pharmacy has many channels and layers as well. We can talk about national retailers or independent pharmacies, and maybe most people know the difference between that. But then when you start getting into true institutional pharmacy versus sports medicine pharmacy, and so that kind of triggers probably the last important question I have is, as an organization, it is our job to first and foremost do what we think is in the best interest of patients. That's why even the pharmaceutical industry and the people that are in it feel very passionate. If they're not a provider like a pharmacist or physician, I think most of us get into this because we want to do something better, and help the outcome of patients. And back to my point earlier about listening. So what kind of thoughts and ideas do you have, given the dynamic and variability within the pharmacy channel? What, as a company like us, should we continue to think about to do better? Are there any ideas or thoughts that come in terms of obviously we can continue to communicate well and provide information, but how is there a next level, that next gear in terms of how we should engage with pharmacy? Because ultimately that's why I'm here. That's why I'm taking the time today as the CEO of the company is to listen. And if we're going to make a commitment to the pharmacy channel and all the different options, are there things that from your perspective are important for us to listen to and give significant consideration in terms of how we can engage and help? And because maybe we have to help an independent pharmacy dynamic like you were articulating, different than somebody that's in a more formal sports medicine channel. So any thoughts that come in terms of how we should think about engaging the community at an even better level than we have, hopefully?
Yeah. No, I think one of the biggest things, and you kind of spoke to it, is that what I see in a community pharmacy is that a lot of the pharma companies will come into us and they're like, this, and they'll tell you everything that they told, the same thing they told the hospital pharmacist, they told sports med, they told geriatrics. They have a spiel, and that's what you get. And I sometimes would like, is there some customization to how can I help the independent pharmacy? How can I help the community chain? How can I help a smaller chain? I feel like listening and understanding that there are differences in the field of pharmacy and the way we practice, and that those differences may require adjusting to how you support a hospital system or hospital group of pharmacists versus maybe some independent pharmacy groups or just independent pharmacy network in general. And I think that is really impactful because so many people are like pharmacy and they feel like it's all this fits into one box, and it truly doesn't. I think in the end, we all have all the same goal is we want the patient to be healthy and the healthy outcomes like you guys do, but we all have different struggles. We have different needs. And so being there to listen to the stories, how are we interacting with patients? Where do we need the support? Where can we do some additional education? I mean, I get education sometimes I'm like, I'm never going to use this. And they're like, we can tell you on how to do a transition for a patient out of a hospital. And I'm like, I don't discharge patients out of the hospital. I need to know how this works in a community pharmacy after 90 days. Situations like that. And I'm like, don't just give me the same spiel. So I think listening and understanding the differences in some of the different major roles is really powerful. And being able, like you said, you guys are there to give options to patients about pain management, give options to pharmacists on education and on needs. So I think it's kind of in the same similar kind of comparison is that we do need options and we are different. And so we may have different needs than other ones.
Well, I'll turn this over to Todd in just a second, but I'll have to say that I think she just signed up to work with us on understanding all those options across. And we have her on tape, right? So Jessica, I think your point to me really resonates because the one thing that we also try to talk a lot about at our organization is about functional intelligence and situational intelligence, and that how the two really go together to create success. It's not either one, and functional intelligence is something that can be learned because we can read a book, we can go to class, we can have the experiences in our day jobs, but I think situationally we lose sight that how powerful and important it is that when we have that functional intelligence and knowledge, how are we translating within those individual situational dynamics, because they don't always apply, as you so rightly said. So that's really a key takeaway for me, is that when we think about how we're communicating pain management, how are we going to how do we need to provide support that independent pharmacy that's overwhelmed, trying to get things done, are dealing with patients at a different kind of flow point, or maybe a different dynamic where they are the primary resource versus somebody that might have a sports medicine pharmacist or a platform or something like that. So I would look forward to talking to you more about some of those examples so that we can continue to refine. I use this word a lot about I use it in my personal life, but I use it, I think, with work. And how do we continue as an organization to be authentic? Authentic in a way in terms of, obviously we have to promote our products correctly, which we do. We follow all the regulatory, but how do we have a more honest conversation? And through that conversation and listening, we will find some of those answers. So I can't thank you for your insights today. It's been very, very helpful. But I'll turn it over to the master.
The RX Podfather, huh?
The pod.
Yes.
So, Jessica, this is always insightful when you come on. Like I said, I'm all about following the trends that are becoming the future of our profession. We're pulling away from the dispensing of a medication, and now we're starting to get into the actual treatment of what the physician says, here's what we need to move forward with. Well, guess what? It's not the physician that is driving the treatment. It's the pharmacist. And being able to take a medication, being able to add supplements or vitamins or some kind of protein or something in the realm of sports pharmacy and athletics pharmacy is so important and key. And keeping people healthier so that they can perform, so that they can keep going. The dopamine, I'm sure, since I started working out again about a year and a half ago, it's addictive. And if I get injured, I do not want to stop. I want to keep going. And I need my sports pharmacist to help me do that.
Especially as we're getting older.
Yes.
But you know what? You actually made a really good comment, and I think something that might just have to be a secondary podcast with Jessica. Jessica, one of the things we do as a company is we try to look at those patients. So in, for example, my prior life, in a prior company, we had products for cystic fibrosis. And when we looked at how we wanted to build our business to support that patient, it was not just the product specific for the indication of cystic fibrosis and what they needed, the antibiotics and other things like that, but it was the complementary assets. Supplements was a big one for those patients. And that's something that maybe we could delve into another episode, because, if we are looking at how we continue to provide value and build out a portfolio around an area that we're in, maybe there's other things that we need to really think about. When you're managing pain management, what's the other effects? Yep. What's the other set of products that a patient most likely or might need because of the interplay between what they're doing? So that's a really kind of a cool idea, because now you got me thinking about how we're going to continue to build our portfolio.
I was going to say that pain, I think aches and pains is one of the things I get the most questions about as a pharmacist, not only in the sports world, but even in my community pharmacy. As people get older, they're aching a little bit more. They want to know what they can take. They don't want to, having seen the opioid crisis, having seen some of those videos come out, like Dope Sick and painkillers, like seeing what that happened, and people are like, I don't want them. And they're trying to figure out, I think, especially since COVID happened, people are wanting to try and manage more. What can they do as a whole person? So which I'm grateful for, having many more conversations about what can I do in my diet? What can I do movement wise? What can I do sleep wise? What can I take as a supplement to help? Are fun conversations for me as a pharmacist to have, and seeing patients wanting to do that, which is really powerful. Or if they're injured, they're like, what can I do to get better faster? What changes do I make to help my body? And so being aware that this is not just like, it's not an isolated incident, and that our whole bodies are intertwined, and there's so many foundational skills of, movement, sleep, nutrition in order to have a healthy patient is really helpful. So those are some of my favorites.
Yeah, that's, and obviously varies between men and women. It might be an issue there too. So ironically, our company and our sister company, our branded company, we have recently introduced a line of OTC vitamins in a ODF, or oral dissolving film format or platform. So, it's something you simply put on your tongue and it dissolves and absorbs in the gut. And we have products like vitamins B12, D3, and iron in particular. I'd be really curious to see how you look at that. Does any of those type of products factor into overall pain management? And obviously there's acute and there's also more chronic. So I think we got ourselves another podcast.
Episode 2.
Jessica's coming back.
We're not letting her go. We like her too much.
I love it. Hey, there's going to be listeners that are listening right now. They're in their car, they're jogging. In your show notes, there's going to be a link to Jessica's LinkedIn profile. So if you're not linked into her through LinkedIn, please do so. Click on that link. Go ask for a connection. Jessica, you are always so open to helping other pharmacists understand the opportunities before them for their own careers, but more importantly, the impact that those pharmacists are going to have on the people they serve and their communities and their patients. And that's so important. So you're a beacon of light. I'm just so excited to know you, and you're in my network, and I'm constantly watching your content that's coming out. I'm also very excited about your own aspirations as an athlete. I want to applaud you for the records that you've set in weightlifting and in moving forward as a pharmacist. You're a champion and a leader, and I just want to thank you for being on this show today.
Thank you, Todd. That means the world. Those comments just means the world to me. Thank you. I appreciate it.
I would certainly echo that. It's been a pleasure to get to know you, Jessica, and I look forward to continue to working with you in a positive way.
Yeah.
And it's great to meet people that have such great dimension. I always tell my kids that it's not just about what we do at work, it's what defines us outside of work and things like that. So I don't think I do want to ask you if we have to do weightlifting, because then I think I'd lose. But maybe I could hold my own with you with a camera in my hand or something. But yeah, I can take pictures of all the great accomplishments than record holding.
I love photography, so I'll take you up on that.
Well, then I'm going to lose twice.
I appreciate you both having me, and both for what you guys are doing, Todd, for what you have created, and Stephen, for what your company is trying to do that is basically changing the direction of how somebody might view pharma and like trying to get out there and actually make an impact in a positive way. Thank you for that. So you guys are awesome.
That means a lot because our new motto of the company is do things differently. And that's not always easy in the pharmaceutical industry because it's a highly regulated. And we're not saying that we want to do things differently to ever color outside the lines. But I'm at a point in the career where in our organization, the passion of the people that we have in our organization is to do right by patients and to listen more, as I said, and to have a conversation that will ensure the right choices that are made by the professionals are being made. So, at the end of the day, pharmaceutical companies make pharmaceutical products as part of the healthcare continuum for patients, but it's the pharmacist, it's the physician, it's the nurse and the other healthcare providers that are ultimately responsible for that care. Our job is to make sure that they have the tools, the insight, to make the best choice for that patient, and that's what we care about. If that happens, then our business will take care of itself, and that's what we care about.
I love that.
Thank you so much for listening to today's program. If you are interested in learning more about sports pharmacy, please reach out to the Pharmacy Podcast Network. We will get you tied in with Jessica, but also Brandon and his team down in the great sunny state. And Sports Pharmacy Network is thriving. It's growing. It's a network of sports-oriented pharmacists and athletic training pharmacists. So if you want to be part of that, please go to your search engine when you're not driving. Don't do it while you're driving. And put in Sports Pharmacy Network. It'll come right up. And shout out to our sponsor, Yaral Pharma. Thank you so much for leading the way in pain management options. And if you would like more information, please take a look at yaralpharma.com. That's YARAL pharma.com. And we thank you so much for listening today. And Stephen, thank you for being in the studio with me and being my co-host.
It's always good to be your wingman. It's always good to be with you and keep doing what you're doing. It's making a difference. And collectively, I think the people on this podcast today all have the same spirit. So the more we collect people like us, the more hopefully universally we will have fantastic outcome for the people that we serve.
Absolutely. Thank you for listening.
Thank you.
Thank you.
Please wait for important safety information.
Diclofenac epolamine topical system 1.3% is a non-steroidal anti-inflammatory drug, NSAID, used for acute pain from minor strains, sprains, and bruises in adults and children aged 6 and older. Serious side effects may include increased risk of cardiovascular and gastrointestinal events. NSAIDs can raise the risk of heart attack, stroke, gastrointestinal bleeding, ulceration, and perforation of the stomach and intestines, which can be fatal. The risk for serious cardiovascular events may occur early in the treatment and may increase with duration of use. Elderly patients and those with history of peptic ulcer disease or GI bleeding are at a higher risk for serious GI events. Do not use in patients who are allergic to diclofenac or any of its ingredients or have a history of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs. Do not use in the setting of coronary artery bypass graft surgery. Avoid use on broken skin. Discontinue immediately if signs of hypersensitivity occur. Patients should be informed about the warning signs and symptoms of liver problems. Discontinue use if abnormal liver tests persist or worsen, or if signs of liver disease develop. Avoid using diclofenac epolamine topical system 1.3% in patients with severe heart failure unless the benefits are expected to outweigh the risks. The common side effects include itching, nausea, and headache. Patients should stop use and consult their doctor at the first sign of skin rash or other signs of sensitivity. Patients should ask their doctor if diclofenac epolamine topical system 1.3% is right for them. For more information and full prescribing information, including box warning and important safety information, visit www.yaralpharma.com. Lidocaine patch 5% is indicated for relief of pain associated with postherpetic neuralgia, a common complication of shingles. It should only be applied to intact skin. Lidocaine patch 5% is contraindicated in patients with a known history of sensitivity to local anesthetics of the amide type or to any other component of the product. Cases of metima globinema, a rare blood disorder that affects how red blood cells deliver oxygen throughout the body, have been reported in association with local anesthetic use. It is important for patients to store and dispose of lidocaine patch 5% out of reach of children, pets, and others. Applying lidocaine patch 5% to larger areas for longer than recommended wearing time could result in increased absorption of lidocaine and high blood concentrations, leading to serious adverse effects. Patients should avoid contact with water, such as bathing, swimming, or showering. Reactions may occur at the site of application. These reactions are generally mild and resolve within a few minutes to hours. Allergic and severe allergic reactions associated with lidocaine, although rare, can occur. Patients with severe hepatic disease are at greater risk of developing toxic blood concentrations of lidocaine because of their inability to metabolize lidocaine normally. Advise patients to discontinue use immediately and seek immediate medical attention if the following signs or symptoms occur: pale, gray, or blue-colored skin, cyanosis, headache, rapid heart rate, shortness of breath, lightheadedness, or fatigue. Patients should ask their doctor if lidocaine patch 5% is right for them. For more information, including full prescribing information and important safety information, visit yaralpharma.com.